All right, let's talk about something huge, a condition that affects nearly 1 in 10 adults all over the world, type 2 diabetes. For decades, it was pretty much seen as a one-way street, right? A progressive disease you just had to manage. But what if? What if that whole story is changing? We're going to start today with a big message of hope, because the science, well, it's rewriting the rule book on this.
Look at this number, 46%. Let that sink in. That's nearly half. We're talking about the percentage of people with type 2 diabetes who actually achieved remission in a major clinical trial. And get this, we're not just talking about better management, we're talking about remission. And how'd they do it? Not with some fancy new drug, but with structured lifestyle changes. That's it.
So this just blows the whole thing wide open, doesn't it? It makes you ask a really powerful question. What if type 2 diabetes isn't a life sentence for a lot of people? What if it's actually reversible? Now, to get how that's even possible, we got to look under the hood and see what's really happening inside your body. So let's dive right in.
Okay, so if we're going to talk about reversing this, first we have to get to the root of the problem. And really, it all comes down to a breakdown in communication, a broken signal inside your body.
So in a healthy body, it's actually a beautifully simple system. Here's how it works. You eat something, and that food turns into glucose. That's sugar in your blood. Your pancreas then releases insulin. Now think of insulin like a key. That key goes and unlocks your cells, opening the door so the glucose can get inside and be used for energy. Simple, elegant, perfect. But with type 2 diabetes, things start to go wrong. It's like the locks on your cells get rusty. They start ignoring insulin's signal. They become insulin resistant. At first, your pancreas is a trooper. It works overtime, pumping out more and more insulin, kind of like shouting to be heard in a really loud room. But you can only do that for so long, right? Eventually, after years of this, the pancreas just gets worn out. It can't keep up anymore. And that's the moment when sugar has nowhere to go. It gets stuck in your bloodstream. And this right here, this is the absolute key difference between type 1 and type 2 diabetes. See, type 1 is an autoimmune thing. The body just stops making insulin. But type 2, which is, by the way, the vast majority of cases, over 90%, that's a metabolic condition. And that one word, metabolic, changes everything. Why? Because unlike an autoimmune problem, a metabolic one can often be changed. Now, here's the thing that's kind of wild, and honestly, a little scary. This whole process, it doesn't just happen overnight. Nope, it's a really slow, really silent progression. Okay, and this is a point that so many people miss. The journey from just the very beginning of insulin resistance to an actual type 2 diagnosis, that can take 10, even 15 years. Think about that. For all those years, your pancreas is just working its tail off in secret, just to keep your blood sugar numbers looking normal. This is a massive, silent window of opportunity to make a change. And here's the dangerous part. During all those early years, you feel totally fine. You'd have no idea anything was wrong under the surface. That's exactly why it often gets discovered so late, sometimes only when complications have already started to show up. That's why regular screening is so important if you have any risk factors. But listen, here is the single most important thing to take away from all this. That progression, it is not inevitable. Think of it like a highway. There are multiple off-ramps you can take. You absolutely can change your direction. So let's talk about how you do that. And that brings us to, honestly, the most hopeful part of this whole story, the real hard science behind reversal. So check this out. There was a major study in the UK called the DIRECT trial. And what they did was they put this whole idea of remission to the test. But not with a new pill, no. They did it with a structured, intensive weight loss program. And the results, they were absolutely stunning. Just look at this chart. You can see it clear as day. Remission was directly tied to how much weight people lost. And look at that last bar. This is incredible. A whopping 86% of the people who lost over 15 kilograms put their diabetes into remission. 86%. That's a game changer. So what are we actually talking about when we say remission or reversal? Well, in medical terms, it's pretty specific. It means getting your HbA1c, which is basically your average blood sugar over the last 3 months, back down into the non-diabetic range. And here's the kicker, doing it for at least 3 months without needing any diabetes medications. Okay, so why on earth does this work? Well, the leading theory is something called the twin cycle hypothesis. And the idea is pretty simple, actually. It suggests that excess fat doesn't just sit on our hips, it gets stored inside and around our liver and pancreas. And it basically clogs them up, stopping them from doing their jobs right. So when you lose a significant amount of weight, you're not just losing it from the outside, you're decluttering those internal organs, which lets them kind of wake up and start working properly again.
Now, the research is pretty clear on this. The sooner you act, the better your chances are. That first 6-year window after a diagnosis, that seems to be absolutely critical. It's your best shot to make a change before the pancreas gets too worn out to recover.
Okay, so the science is solid. Reversal is possible. But how do you actually do it? How do you put all this into practice in the real world? Well, it all starts with having the right tools, and just as importantly, the right knowledge. The foundation for all of this is really built on 4 key pillars. We're talking about nutrition, what you eat, exercise, how you move your body, sleep, and yes, it's a big one, and finally, stress management. Each one of these plays a huge role in how sensitive your body is to insulin. But here is the secret weapon, the thing that most people totally miss. This is not about following some generic, one-size-fits-all plan. It's about data, your own personal data. Because your body is unique. The food that sends my blood sugar on a roller coaster might be perfectly fine for you. And the only way you can ever know for sure is to track it and see the cause and effect for yourself. It really is the difference between just guessing and actually knowing what works.
And that's where technology can be a total game changer. You've got tools now, like My Health Gheware, that are literally designed to be your personal health detective. They can take all your data, your glucose, your meals, your sleep, your activity, and its AI connects all the dots for you. It finds those unique patterns in your body and shows you, hey, this is what's working, and this is what's holding you back. You know, if there's one single truth I want you to walk away with, it's this. Type 2 diabetes responds, and responds dramatically to what you do. This is not just some passive thing that happens to you. You have a massive amount of control over your own outcome.
So, it all comes down to this, right? Knowledge really is power. And now, you have the knowledge. The real question isn't, is reversal possible anymore? We know it is for many. The question is, what's the one small change you could make today to start your own journey?
You can start that data-driven journey to taking back control literally today. To learn more and see how it works, you can visit health.getware.com.
And of course, please remember, all of this is for educational purposes. It's so important that you always work with your own doctor and healthcare team to come up with a plan that is safe and right for you.